Doctors of Reddit, what do you do when you see a patient is obviously faking it? As a paramedic, I have been known to fake the faker. I had a girl in my district that would fake seizures all the time. I'd usually put normal saline in a nebulizer and fog up the back of the ambulance while telling my partner that the anti-seizure mist was on and she should be all better soon. Funny how she woke right up every time. When I was a young teenager, I had developed this crippling pain in my stomach. One time I was in the ER being treated, and the doctor performed a bunch of standard tests on me: blood, urine, CAT scan. They couldn't seem to find what was wrong, even though I was doubled over in tears. Then came a shift change. Dr. A explains everything that's been going on to Dr. B, who will be taking over. Now they were standing right outside my room and I could overhear them, and ERB suggest that I'm faking it for attention from my parents. Needless to say, he discharged me shortly after. 4 years I suffered from these pains until one day at 25 I had a doctor who decided to actually do her damn job and tested my gallbladder function. And miraculously that was the problem. Instead of releasing bile to aid digestion like a normal gallbladder, mine just had a seizure pretty much, and this caused all sorts of pain and other symptoms I was experiencing. And the simple fix was to just remove the offending organ. In short, fuck that doctor that doubted me. TL. Doctor thought I was faking stomach pain. Turns out I had gallbladder dyskinesia. Former paramedic. Fake seizure? Oh my, it's too unsafe to move them like this. We'll have to put in a catheter first. And wouldn't you know it, a miracle. I'm an EMS pilot, and the nurses/medics have shown me a couple of awesome tricks they use on fakers. When they are sure a person is faking, that they are unconscious, they will lift the person's hand up over their head and let it go. The fakers won't let the hand flop down directly onto their face. If they're out for real, it'll go straight down. Another fun one to watch is when a person's faking a seizure, the nurse will announce loudly that they are going to start an IV on a specific arm. It's funny to watch somebody faking a seizure with 3 limbs moving instead of 4. Doctor here. Fakers are difficult to handle. Adult fakers are usually quite sad affairs, and there is really no satisfaction in exposing them. One story is a young guy in my town who has a weird and unexplained addiction for getting a cast. Not having one, getting one. He has come into difference claiming an injury, but there are never any objective finds. Then he usually gets a cast. Since he is in pain, he gets one for pain relief, and then comes in multiple times because he got his cast wet, the cast hurts and so on, and gets another one. He has done this so many times that he is now well known by most staff and doctors in the ER. I met him once, and since I hadn't looked at his patient history beforehand, I believed him and sent him to the relevant examinations. And even if I did know his history, it would be wrong of me not to trust him, because this time the injury might just be real. It's more important for me to protect my ass, even if it means that some extra work is done for nothing. And in my country this guy doesn't pay the actual costs of having these x-rays and ultrasounds. TL. Doctor, some people fake it, but since you have more to lose by exposing them, you usually just try to be professional and move on to the next patient. We get a lot of training for this in school for audiology. People fake hearing loss all the time to get workers comp or money from the government for service-related hearing loss. Here's the thing, we can always tell. There are only a few specific ways that the way you hear through air conduction, when the sound has to go all the way through your outer and middle ears before reaching the cochlea, and bone conduction, when vibration of your skull sends the sound straight to your cochlea, can interact. People who are faking tend to pretend their hearing loss is flat across all the frequencies. If someone is pretending to have hearing loss on one side only, there is even a special test called the Stenger that we can do. Basically you play sounds in both ears, but the brain only perceives the louder sound. So as soon as the sound in the person's bad ear gets louder than the other ear, they stop responding. We are trained not to ever let on that we know the person is faking. We blame it on the equipment. We move to a new sound booth. We tell the person that the test results just aren't matching up, and we should have them come back another day. Basically you give the person every chance to tell the truth. If they never admit to the fact that they are faking, we can run a test that measures brain waves in response to sound and prove their approximate thresholds that way. However, some people have psychosomatic hearing loss, where they truly believe they cannot hear, even though they physiologically can. In kids this can be caused by trauma or abuse, so even if we really think a kid is faking, we would never tell their parents that in case it meant additional abuse for the kid. There is a point at which we bring in social workers, psychologists, etc. I'm a doctor, but as a pathologist I don't have to deal with malingerers directly anymore. I just get to do their autopsies and say, well, I guess they weren't faking this time. Not a doctor, but once when I was a kid, my doctor knew I was faking sick to get out of school, so he told me he thinks there's a problem with my sex organs. I was faking the flu, and asked me to take my pants off. I immediately felt better. When I was young I used to get sick on a fairly regular basis. The majority of the time I could tell my doctor thought I was faking it. Luckily, my grandpa was a doctor and my family believed me, so they'd keep pressing on. At one point, my doctor diagnosed me with fibromyalgia, which I know is a thing, but pissed me off to no end. My family thought that was probably it though, and let it rest. They gave me painkillers, and while that did take care of pain, it didn't stop me from getting sick, strep throat, sinus infections, etc. Halfway through college I get a new doctor, and she recommends looking at my blood sugar levels. It turns out, that was my problem. Reactive hypoglycemia had my insulin rising and falling at inappropriate times, and had seriously fucked with my immune system. I changed my diet and guess what? I rarely get sick now. I'm amazed at the radar doctors possess. I wish I paid more attention to their subtle unexpected reactions to my ex-wife. Her tears and agony never swayed the direction of their professional conduct. Her social intelligence and ability to manipulate were extraordinary. It was not her body that was ill, they knew. Her health was a weapon. I could not abandon her, despite a near constant onslaught of abuse. Seeing the response of medical professionals helped me regain sane perspective in my life. Thank you doctors. Last semester I took a few Adderall from a friend to get through finals, and felt like they really helped me out for studying. So I decided to go home over break and meet with my family doctor to see if I could get prescribed them. I more or less planned out my entire speech I would give to try and convince him I had and that I just hadn't noticed before. I'm 23. He comes in, I start to explain my situation. He first tells me I might be mixing up depression with that, and that I might need antidepressants. Then I tell him I don't think so, and that I just need help getting through school. He chuckles and asks me what I'm studying. I tell him engineering, and he then proceeds to pull out his prescription pad as he makes jokes at me. Oh yeah, I can't focus too. I never actually went to med school. I just couldn't focus, you know, etc. He finished by asking me what dosage I wanted, how many I wanted, and then handed me the piece of paper and left. As a doctor, never doubt your patient until you can prove him wrong. He wants to feel better in some way. Look up whose definition of health. I worked in a public hospital where sodium solution was prescribed to patients that were suspected of faking catatonism. That shit hurts as hell. Hypertonic solution in muscle. Instead, I did something more humane. I gave her crisis anxiolytics and referred her to a psychiatrist. It normally turned out they were left by the guy that left her pregnant with a second child while she comes from a low-income house with no studies. That hurts more than your average headache. As a doctor you have to understand something. People that fake diseases either feel the disease or need the break from their world and can't handle their stress properly. Both type of people are sick people and need a psychiatrist, not a man up. At least they need a good heartfelt talking, some empathy, maybe you even save one or two from the brink of suicide. Even kids that call in sick too often must be running away from something they perceive as humongous and dreadful. And besides, you always have to clear up every physiological and functional pathology before even thinking about psychiatric and emotional problem. What if that person is complaining about a foot and headache because of a tumor? Care for your patient's life as much as can, holistically, because they trust you blindly as someone that will make them feel better. Do your work and you'll avoid ethical, remorse and legal issues. Fucking be nice. I always worry that when I go to talk to the doctors about my depression they won't believe me, and it's kind of hard to prove how things go on in your head and how you can be fine one minute and be terrible the next. I had flu-like symptoms for just under a week and was sleeping a lot. One afternoon I woke up from a nap and couldn't move. I felt like I was being stabbed in the side. I started screaming for my family. I was in grade 6 at the time. My dad comes running and has to carry me to the car to take me to the hospital. I was crying and gagging from the pain every time my body moved. They admit me and run all sorts of tests. They think it's appendicitis, so they do an ultrasound but find nothing. I'm in the hospital for just over a week. I'm not allowed to eat anything, just allowed to drink flat ginger ale. After a few days, I'm not feeling any pain. Jacked on meds I'm sure. There was a classroom in the children's ward, so after coming back from doing some work my school sent, a doctor comes by to see me. He sits on the corner of the bed and informs my mom and I that he thinks I should go home. I'm looking better, feeling no more pain. I cry and tell him no, something is wrong. I'm not feeling any more pain, but I just know something isn't right. I'll never forget that feeling of just knowing something is wrong, but can't describe it. He clearly thinks I'm faking it. Sure enough he takes my mom out in the hall and I hear him tell her he thinks I'm exaggerating and if anything changes at home, to bring me back. When he comes back in, I lose it and refuse. I know something is wrong and this idiot is refusing to listen to me. My mom looks at me and says she trusts me and asks him to reconsider. He leaves and about 2 hours later comes back and gives in. He says fine, stay another night. He'll order another ultrasound the next day to make sure, but if it comes back with nothing, I'm going home. So the next afternoon, I go in for an ultrasound. And guess what they found? My ready to burst appendix. I was in surgery later that night. I knew a kid who was in a therapeutic wilderness program and faked a rattlesnake bite by poking 2 holes in his hand with a cactus needle. The guides bought it and he had to be evacuated by helicopter. The doctor gave him anti-venom and could obviously tell the kid was faking it. This asshole ended up costing his parents $50,000 over nothing. A couple years after my concussion/traumatic brain injury my mother informed me that when the paramedics arrived after I was hit in the head the paramedic was almost 100% certain it was no big deal because I was just a 7th grader faking it or freaking out for smoking weed for the first time. Shouldn't paramedics give their patient the benefit of the doubt regardless? Especially when sometimes they can clearly be wrong. Not a doctor, but I learned that the best way to wake up someone who passed out is to squish down on their index finger on the nail. It's a pain you can't ignore, but causes no damage. This one has worked a charm when out drinking, and some bitch wants attention. On the flip side of this, when I once took an overdose, long story, the horrible ear doctor thought I was faking and did this trick, but on my eyebrow ridge so much that I ended up with 2 black eyes. Needless to say, I wasn't faking. I also had them jam a needle into the nerve between my thumb and wrist and had huge bruises after. I don't really like doctors much after this. Ever since I was little I was getting terrible headaches that only got worse. Every time I went to the doctor he would pretty much roll his eyes at me, tell me to take some ibuprofen and just go back to school. They progressively got worse, and I mean worse, like the equivalent of a migraine times 10. One night it was so bad that I had to go to the hospital because I was puking from the pain. Turns out I had a malformation in my neck/brain/spine that required 3 brain surgeries to fix. Fuck doctors that assume patients are faking it. Do your job.